Well, lately we have heard a lot about women and cancer with Princess Kate's announcement. However, men also need to be aware of their cancer risk and importance of early detection. So today, Dr. Theodore Manny, a urologist in the Triad and member of the Cone Health Medical and Dental staff, is joining us to talk about prostate cancer, the risk and screening options for this common and treatable cancer, and when you can be diagnosed. So thank you, Dr. Manny, for being here today with us.
Thank you, Sydney.
All right, so how common is prostate cancer?
Prostate cancer is very common. It affects 1 in 7 men. It is actually the second killer of men in terms of cancer, only behind lung cancer. It is very common.
Let's talk a little bit about the risk factors and increase a man's risk of prostate cancer. Let's talk a little bit about that.
Sure, there's three main ones to keep in mind. The first one, of course, is age. As men age, prostate cancer does become more common in general, so age is the first one. The second one is family history, and this is a big one. Those of us that have a father or a brother, an uncle, other men in the family with prostate cancer, that does increase our risk as well. And the last one is ethnicity. Folks of African heritage, they tend to have higher rates of prostate cancer, and it does tend to be more aggressive as well.
Which out of those risk factors, which ones do you guys see, the most or a lot? And there may not be one that's more than the other, but just curious to know.
The biggest ones for me, again, are family history and ethnicity. Our friends of African heritage, it is super important to be screened.
Okay. And are there signs and symptoms of prostate cancer men should be aware of?
There are, but more impressively is the lack of them. Prostate cancer is something that when symptoms arise, that usually means that the cancer has already spread other places. And at that point, oftentimes it's incurable. So that's why it's so important for men to be screened, so we catch this before symptoms arise, when we catch it at a time when it's completely curable.
What do those symptoms look like?
Sure, the real worrisome symptoms, of course, would be blood in the urine or actually new pain in the bones. Prostate cancer likes to spread to our bones, and that can be a sign of that is new and unusual bone pain. Occasionally, a man will have problems passing urine, and then that can be a sign as well.
And as soon as someone may start seeing those types of signs, talk about what they should immediately do after and next.
Sure. The first thing is just have a conversation with your trusted healthcare provider. We're very fortunate in the Triad to have many good primary care doctors, as well as specialists such as myself. Just have that conversation, bring up those symptoms, and ask, is prostate cancer screening right?
When should men consider getting screened for prostate cancer? I'm sure that goes hand in hand with age. So maybe we can start talking about age too.
It sure does. And so, our general screening criteria are for most men who are not high risk, really ages 50 to 70. Between ages 50 to 70, men should be getting an annual screening once a year with a PSA blood test and exam. For those folks who are at a higher risk, fellows of African heritage, family history, we do start screening a bit earlier, starting at age 45 and taking that all the way out to 75.
Yeah, 45. Wow. Is that kind of the earliest age you guys have been seeing people with symptoms?
Usually so. And then that brings up an important, misconception is that, a lot of folks have this idea that prostate cancer only affects older men, but it does affect men in their middle age as well. Just even 2 weeks ago, we diagnosed a man in his mid 40s with a very aggressive case of prostate cancer. So it really is important to start having that consideration even in our mid 40s.
Is there an age that a man should not worry about having their PSA exam or PSA test?
It's a great question, Sydney. In general, after about age 75, at that point, usually screening is not very high yield. If prostate cancer was going to cause a problem, it usually would have by then. So after age 75, I tell men you've graduated from it. That's something we don't have to worry about much anymore.
All right. And, once someone starts seeing the symptoms and then the signs, of course, the important thing is to go to your primary care doctor. Kind of talk about what that conversation should look like. How should they be describing that they are seeing these signs and symptoms with their primary care doctor? Talk about that initial conversation.
Sure. The most important thing is not to be embarrassed. These things we're talking about, especially to men, they can be kind of embarrassing. So it's okay just to have that conversation and just be honest. Be honest that you're having some changes in urine function or having some symptoms that you're worried about. The main thing is just don't be embarrassed and be honest. Your primary care doctor, they'll certainly appreciate that.
Yeah, I think that's an important nugget to say. Thank you so much, Dr. Manny. We're going to pause right here and we'll be right back after the break.